I was away and could not do the advocacy call on Tuesday, so I thank you for your understanding in this one-time date change. Usually it's the second Tuesday of the month, and had to change it to Thursdays. But thank you so much for joining us. We have quite a bit to talk about, especially State House and marijuana are going to be the two things that we mainly discuss this morning. There's an awful lot going on at the State House. The lame duck session is going on now, which is just a bunch of bills that's going through very, very quickly. It's also a time that amendments, it's interesting how some bills can actually become amendments to other bills, so and they don't need a vote on it. So usually you would have, oh, do we accept this amendment? Don't we accept? In a lame duck session, it's more of a, we're adding this amendment. Usually the non-controversial bills. When I was with Hope Taft, one of the bills was a very non-controversial. Third week of September is Parents Week, and somebody during lame duck added this very odd and quite controversial piece to that bill, and it almost didn't pass. But that's what lame duck's all about, is let's try to get everything we can in a very, very short amount of time before people either are relieved of their spots in the legislature or there are other changes. The first bill that I'd like to talk about is House Bill 594, which is the crystalline alcohol, the powdered alcohol bill. It is now in the Senate Agriculture Committee, and the powdered alcohol bill, there was a meeting a few weeks ago, and I sent out a legislative action alert last week that we would like for folks to call their senator. From what I understand, there's a little bit of pushback in the Senate against this bill, and they also want to add some amendments, which we can talk about in a second. But right now, we need folks to be calling their senator. Please understand, however, that if you put this to time and you're doing it from your agency, that this is considered lobbying. So if you spend 5 or 10 minutes, you'll have to report that as lobbying and not use federal funds, especially if you're a DFC. If you want to do it on your off time, not representing your agency, or you do want to label it as lobbying with unrestricted funds, we encourage folks to do that too, because you're actually asking them to vote in favor of of House Bill 594. Some of the amendments that we know are added to this bill. Again, this bill would ban powdered alcohol across the state of Ohio and the sale of it. And some of the amendments are more they're having a tough time with the mid-biennium review budget bill for the Ohio Department of Agriculture. So they're going to stick some of the more the non-controversial pieces in to the from that mid-biennium review bill onto the powdered alcohol bill. So those amendments will be added. There also an amendment added from former Supreme Court Justice O'Donnell, and he actually wants to add in the ability for people to, I guess you can't receive mail rebates from alcohol companies, and he wants to change that. So they're trying to add that amendment as well, that people would then be able to, if Coors sends, you can get a $6 rebate or something, check by mail. You can't do that in Ohio. I don't know how it works on rebates, but this would allow rebate checks to be sent to people in Ohio for beer rebates by Coors and Budweiser and whoever else. The other amendment that has not been added, however, we have heard that it's been rumored that it's kind of floating around, and they're thinking of attaching it to this bill, is the entertainment districts language, which would exempt folks from the open container law in entertainment districts. And what are entertainment districts? Which leads us right into Senate Bill 116. Entertainment districts, according to Senate Bill 116, which actually passed the Senate and is now in the House, would allow municipalities over 35,000 people. It was, at one point 150,000, and then the last bill was, a few months ago was 50. Now it's dropped to 35,000 people. If you have a municipality over 35,000 people, you can have an entertainment district, which would allow people to walk from restaurant to restaurant. You have to have at least 4 alcohol-serving entities in that entertainment district, and they would be allowed to exempt the open container law so people could walk around with their alcoholic beverages from place to place. Our issue with that is, when you take it outside the bar, there's more opportunity for kids to get hold of alcohol. Plus, also, I do not understand how folks, servers, will be able to, kind of count the number of drinks that a person has had. I understand that there is some training that can go on to recognize when a person is inebriated or has had too much to drink. However, if the person has had 6 or 7 drinks before in another bar, has kind of carried one over, and you're serving the person now, how does this, how can a person really understand how much the person's had to drink? So they might try to slip that language into House Bill 594. Again, that's a rumor and a rumor only at this point. The other 2 amendments have been added, the alcohol rebate mailings and also the non-controversial agriculture MDR pieces. So those, as much as we want powdered alcohol to pass, if you would call your senator, and again we're urging folks to do that, then we ask that you tell them to pass the House passed version and not the one with all these amendments, because you could slip one in at the last time or at the last minute as well, which we might not know about until after signature. So those are 2 bigger bills that we have been watching. House Bill 508 is still alive. It actually passed the House, which is surprising to me. It basically says that if you illegally sell a person a controlled substance and the person overdoses and dies, then that charge is no longer, I think, manslaughter. It could actually be a charge of murder, second-degree murder, not premeditated. So that's an interesting bill. Again, I'm kind of shocked that it's still around, but it still is floating around out there. House Bill 508. Also, House Bill 367, which is the drug abuse prevention, which would actually require schools to talk about opioid related issues, prevention of opioid related issues in health classes. It would require each school to do that. We are in favor of the bill as a from a fundamental standpoint. However, we would also like it to expand to other drugs, also other maybe even expand funding for more prevention programming in the school districts. And there's also an amendment added. They're trying to find a bill, a vehicle for a bill, the bill that would change some of the opiate law. So there are so many amendments and so many pieces of legislation that are floating around and which attaches to which. And so it really is quite confusing down at the State House right now. and they're working till 10, 11, 12 o'clock at night. So it really is an extremely busy time down at the Ohio State House. The next piece that I'd like to talk about is marijuana updates. There are lots of things, especially going on around D.C. Regarding marijuana. D.C. passed on November 4th. They passed their legalization. They had about 70% of the people vote to legalize marijuana in the district. What was interesting, and what I talked to some of the African American leaders when I was in D.C. on Tuesday, and the way that they crafted this was, we don't need young African American men to go to prison for marijuana-related charges. And what they were saying was that these African American leaders in D.C. were that the African American community actually didn't want it in their neighborhoods. And 75% of white people voted for it, and I don't know how they knew this, but and they said 55% of African Americans voted to legalize. So there's a big discrepancy. Everything was targeting, let's not throw African American males in the prison system. However, white people's perception of this race issue was a big driver in that, and African American, from what I learned from these African American leaders, they were really the African American community was really concerned because they've seen it in other states that these pot shops and these these establishments will end up in minority neighborhoods and target African Americans and the Latino populations. So there seems to be a, in D.C. there was it was more of a race issue tilt to it as well. So they did pass legalization, and the city council, the District of Columbia City Council, actually voted to ban pre-employment marijuana testing. I am in Mansfield today. I'm talking from a car in a Toys R Us parking lot, doing another safety council, talking to 40 or 50 businesses up here in Richland County about the marijuana piece and what it's doing to employers. And this again is another attack on employers. That to ban pre-employment marijuana testing would mean that you couldn't ask it. The Drug Policy Alliance, which is a pro-legalization group, they actually want to legalize all drugs in the country. They've been very upfront about that. Said that even urine tests are discrimination against marijuana users. So they want to eliminate urine tests as well, a long-term goal. If they pass their short-term goal of banning pre-employment marijuana testing for employees in the district. Now, whether this actually will happen or not is yet to be seen, because Congress has to pass what the rules are for the District of Columbia, and they actually have put into the budget bill to keep the government going and we don't have another shutdown. They put some marijuana language in on how to deal with D.C. Congress has, and basically it would eliminate the District of Columbus legalization. That means that they wouldn't be allowed to have pot shops. They wouldn't be allowed to sell it in the district. There would still be medicinal marijuana, but there would not be there would not be recreational marijuana in the District of Columbia, as Congress right now has in the budget bill. There has been a big push from the pro-pot advocates to call their congresspersons to let their congresspersons know to vote against this piece and to allow legalization to happen in the district. So I would also encourage you to contact your congressperson to, vote for the budget bill, the federal budget bill, and to also let them know that there are people out there who do not think that legalization is the way to go. Pro-pot lobby has done a fantastic job at getting their lobby together, getting their advocates to basically make phone calls and kind of even attack some of the legislators that are anti-pot, which was the reason I was actually in D.C. on Tuesday, which I'll talk about in a second. The other piece that is disturbing, however, so they put in that bill, the budget bill, that they would eliminate the legalization in the District of Columbia. However, the federal government also put in language. It's called the Rohrabacher bill, or it was the Rohrabacher bill. Dana Rohrabacher is a congresswoman from California, and she does not want any federal monies to go to enforce marijuana laws in medical marijuana states. So if even if there is an above and beyond, you can have 4 plants or 6 plants or however many ounces. So even if there's a warehouse of marijuana and it goes way beyond what the medical marijuana law says, what happens is that the federal folks will not be able to enforce that. They will not be able to go, the DEA would not be able to go in and enforce those laws and say you have to have 6 plants, not 600. So that's really, really troubling and would open up even more cash businesses for marijuana. So what that would mean, as Monty Stiles put it yesterday in the email he sent, Monty Stiles is a former U.S. attorney from Idaho, and he said that there are no investigations, no search warrants, no arrests, no seizures, no forfeitures, no forfeitures of anything that is disguised as medicinal marijuana. So that's really, really opening up just a huge can of worms as far as marijuana on a national scale. I was actually in D.C. I was called. Kevin Sabet has been on the Hill talking to congresspersons and asking congresspersons, why are we allowing federal law to be broken? And the thing he kept hearing he said from Democrats, from Republicans, from Libertarians, was the same thing. Where is your voice? Where is, we hear from the pro-pot people all the time. We have a well-oiled machine. We hear from pro-pot advocates every day of the week. We never hear a voice from the side that Kevin Sabet and Drug Free Action Alliance sits on. So Kevin called a gentleman, Cully, from the Heritage Foundation and said, what do we do about this? The Heritage Foundation is an organization that began back in the 80s, and it's quite a conservative group. However, they do have some political might and political power on Capitol Hill. So Kevin said that Cully said, let's have something in 2 weeks, which was the thing that I attended on Tuesday. And it was a public meeting. There were 2 congresspersons there, one from Maryland and one from Louisiana, to basically let's look at facts and not just listen to the hype surrounding marijuana. So it was a big piece on our side that was hopefully the starting point of a major organization getting some of their political might out on this. But we have to keep talking. We have to keep saying, this might not be the greatest thing for this country. As we see kids going to the emergency rooms, so much more in Colorado. In Washington, they have tremendously spiked. the number of marijuana poisonings. As we continue to see the issues with psychosis, there was on the panel there was a woman whose son had never had a mental health issue until he started smoking marijuana at the age of 19, and ended up having many psychotic episodes, mostly from edibles, and ended up committing suicide after consuming some of the edibles. So I mean, there are so many issues. Former drug czar Barry McCaffrey was there. Dr. Kevin Gray, who I hope to have at our MAP Summit, which Derek will talk about in just a minute. He was phenomenal. He's the director of the American Academy of Child and Adolescent Psychiatry. I have never heard him speak before, and he said he's just now beginning this, but the more he sees the psychological issues that young people are having, especially after smoking the high strains of marijuana that the kids have now, or eating these edibles, it really, really is a dangerous piece that we certainly need to pay attention to. So with that, we did also, there was a closed-door private meeting as well. I was one of 32 people invited. About 20 showed up to talk about the national focus on marijuana with this heritage organization. I think we got some things accomplished. There's still so much work to do, but there is an organization now that really is trying to put that political might onto Capitol Hill and taking this issue up. So I don't think, as much as people say, oh, the marijuana prohibition is dead, I really don't see that. I do think that there needs to be some changes in the laws, but legalization and creating a market for it is not the way that this country needs to be going. The next slide is about the MAP Summit. MAPS stands for the Marijuana Advocacy and Policy Summit. It's going to be a multi-state event, March 31st through April 2nd. And Derek, didn't know if you wanted, Derek's actually leading it up in the state of Ohio, and gathering all of these other states on to a planning and strategy team. So Derek, didn't know if you could talk about that for a little bit.
Absolutely. Thank you, Tony. The Marijuana Midwest Alcohol Policy Summit we had last year, that was MAPS 2014, and we focused on the Midwest, looking at states that were like ours and related to alcohol policy and close to us, and that resulted in participation in 27 states and 300 total attendees. So it was much broader than we anticipated and really kind of redefined what the Midwest looked like. In looking at kind of the trends that we're seeing here in Ohio and some of the challenges that we're experiencing, we wanted to take the momentum from MAPS last year, refocus it for marijuana this year, and still keep with the branding, color scheme, etc., and the acronym. But this year we'll focus on Marijuana Advocacy and Policy Summit. And with that, we'll be structured similarly we were with the Alcohol Summit, with doing a pre-conference on the first day, followed by a summit the first 2 days of the actual conference. So March 31st will be our pre-conference, and that will focus on law enforcement and higher education. And then we'll have the summit for April 1st and April 2nd. April 1st we'll look at the science behind why we have marijuana classified as a Schedule I drug, and other brain research supporting that. Also, hopefully get some folks talking about the IQ studies and other data that suggests that legalizing marijuana is probably not for the betterment of our people. And one of the challenges that we see kind of not only in Ohio but nationally, and we saw a little change in this with the recent Gallup poll, is that we're seeing a big disconnect between what science says related to marijuana and what we should do in public opinion. So we really wanted to pull that science piece along with that advocacy and policy piece so we can kind of bridge those together. and we'll be located in North Columbus area. The site will be near the Polaris area, if you're familiar with that. And Emily will be sending out an email this week with registration details. And we wanted to continue to keep things very economically priced. So the early bird conference for March 31st will be only $99, and the summit for April 1st and April 2nd will be $199. And that early bird registration will close on January 31st. And for SPECA members, you save 20%. So with the email that she sends out today or tomorrow, then you'll get that coupon code that you can add in there for an extra 20%. So that can be an additional value to not only you and your organization, but hopefully you can recruit some community partners to help address this issue. And then we'll have, again, registration will be out this week for that, and then we'll open it up for the general public sometime next week. We are somewhat limited with the site that we selected, so it will be important to register as soon as possible. We wanted to go with the site that was more secure and not as available to the public, which limited our size a little bit. So the site details, hotel, all that information will be sent within the confirmation emails after you register. And if you have questions about that, feel free to contact me. Tony, we don't have any questions at this time. If you do have questions, please ask them in the question section of the GoToWebinar navigation pane. And Tony, while we're waiting on questions, would you like to mention the legislative breakfast or talk about some of our efforts there?
Yeah, we have a legislative breakfast on January 14th. And what it is, we're inviting new legislators as well as existing legislators to come to the Rife Center, and because opiates are the big, the big drawing card down in at the State House. We have patterned it a little bit around opiates. However, we will also sprinkle in some other things, marijuana, prevention in general, introduce our college initiative to folks, and these types of things. Introduce the many coalitions that that are in communities that are doing the hard work promoting coalitions in the state. It's going to be not only prevention, but we want it to be more broad in how do we combat these. And as you know better than anyone, it can't just be about prevention. It also has the continuum of care, treatment, drug courts, law enforcement, all of these folks. So we have a panel of different individuals that will be talking to legislators on that day. It's 9 to 10 a.m. The space is extremely limited downtown. So, but we do have panelists from law enforcement. The Ohio HIDA, high intensity drug trafficking area, will be represented there. The treatment community, the recovery community, obviously somebody from the prevention. Orman Hall will be there, the recently retired, talking about his plans for how he wants to advocate for a naloxone around the state for those individuals and bringing those folks back. So it really is and also drug courts is another big piece that we met with drug courts, and there may be some more news on those, on what coalitions, how they can partner more with drug courts. We had a lengthy conversation at the Supreme Court building with the drug courts head down here in Columbus. So this will be an important piece that I think hopefully will get Drug-Free Action Alliance, the coalitions, prevention into the minds of legislators, whether they're beginning their new term or whether they're beginning, the new General Assembly. We really want to establish our field in the minds of legislators. So this will be certainly a new undertaking. We've already had some legislators RSVP, so I'm pretty excited about that, and we're looking forward to promoting prevention and promoting what coalitions do around the state. So thank you for that.
And we don't have any questions at this time, so if you do have questions, please ask them in the question section of the GoToWebinar navigation pane. Tony, do you have anything else that you'd like to mention today?
Nope. No. Just thanks, Derek, for doing this, sitting in a parking lot. It's a little bit of extra work on your end, so thank you for lining this up, and thank you everybody for joining us today. So have a great holiday.
Okay, well, thank you, everyone. This ends our advocacy webinar. The next webinar will be on January 13th, also at 10 o'clock, and we'll send out that information for you in the next couple of weeks. And as Tony said, and I echo, we do hope you have some wonderful holiday time spent with your family, and we will talk to you next year. Thanks so much, everyone.